problem. I have one in my house, so I know what I'm talking about. It's not an easy habit to break, but it must be stopped before it continues. So those are some of the habits that harm our teeth.
What about the things we eat? Do they also harm our teeth as well?
Oh, so far as you chew it and you don't have pain, I mean, we are Africans. I can't take bones from you. You can't take bones from us. We like our bones. But then if you chew one stubborn bone and it's not cracking, just let it go. Just give it up. You
Right.
know, because there are some things that you chew and then it can eventually crack your own tooth. So ice, if you chew, fond of chewing ice, it can give micro fractures, and then one day your tooth will just open up. So bones, so very very hard things. Then also eating um, two different foods with two extreme temperatures, cold and hot at the same time. So if you are eating a hot pie with a chilled malt, so as soon as you eat the hot pie, so if you're a bit, if you remember your science, contraction and expansion. So the hot things will expand, then the cold things will contract. So contraction, expansion, the contraction, expansion. One day it will just crack. So those are some of the things that are bad for teeth. Very hot stuff followed by very cold things. So those extreme temperatures, you try not to do that because it can be harmful.
Okay, so when we were growing up, they were telling us to avoid sweets, otherwise we'll get caca. So are sweets also bad?
Yes, so sweets are the number one cause of caries or tooth decay. So when you consume sweets, I mean, everybody has germs in their mouth. Germs are parts of the normal habitual, we call it normal flora. They are supposed to be there, we can't get rid of them. But once they are there and you keep eating these sweets and you don't brush, they act on them. That's what they feed on. And once they feed on, they produce by end products. And those end products are acidic, and that's what damages the teeth. So you end up having holes in your teeth. So as the sweets, so basic sweets. Let me not say the big English of it. It's the sweets, the sugar, and the chocolates, all the sweets we know of, the fizzy drinks. Those are the things that can damage our teeth because of overconsumption and the bacteria in our mouth.
Right. Okay, so this is another one. So during the COVID, there was an advent of, the power of hydrogen peroxide. That if you gargle hydrogen peroxide, you'll be immune to COVID, right? So a lot of these at-home remedies started coming up, and hydrogen peroxide as a mouthwash and as a gargle was one of them. And another one was rinsing your mouth with coconut oil. So you put some coconut oil in your mouth, then you swish it around, and then you spit it out. So these two, are they also harmful, or they had some benefits as well?
Yeah, in the past, we used to use a lot of hydrogen peroxide, but it's been found that if you have any cuts in your mouth and you use hydrogen peroxide, it's more damaging to your tissue, the gums. And so even when you have to use it, you have to dilute it because it has a very sharp effect on your tissue. So hardly do we even use hydrogen peroxide these days in the hospitals. If we use hydrogen peroxide, probably on a tissue that is already dead. Because on a fresh wound, if you pour hydrogen peroxide on it, you're actually killing the body tissue itself. So I'm sure it's potent on the bacteria, but on the human tissue, it's quite damaging. So COVID, a lot of things came up. But as to its authenticity, we'd have to do more research on it. Coconut oil, I wouldn't give it so much thought because it's just basic oil. It doesn't have any antibacterial effects. So I'm not sure even how it started.
Right. What about the elderly who decide that a chewing stick works for me, so I don't care about the toothpaste and the rest? What about them too?
Yeah, so the chewing stick, really, it doesn't have so much um, additives to ensure that the germs are brought to a minimum and it cleans all your teeth. So mind you, people that chew, they don't spend so much time brushing the teeth. It's just a chewing pleasure. I've really not seen somebody use the chewing stick to brush every part. They may brush just the front teeth, and really that's all. And so they will still end up with the other dental health concerns, the gum disease, even the caries. Is because the chewing stick is not meeting all the needs. Yes, it's herbal and it does have some medicinal, purpose, but it cannot meet all the concerns, and so they fall short.
Right, right. Okay, so now when it comes to dental health, we've learned about the processes, the steps, how a routine should look like. So how often should we decide that we would visit a dentist as well?
Yes. So because the mouth, it's also very difficult for you yourself to see every part of your mouth. Even your throat is also important because the back of the tongue, you cannot see yourself. You may see some things you don't understand. It's not everywhere with a mirror. You cannot see everything. So it's best that you let a professional examine you and then see if anything is developing that may need to be attended to. So twice a year, we recommend that you see a dentist. We say that to help you remember, maybe at Christmas time or any special holiday, your birthday, beginning of the year, middle of the year, try and target it with an important date so that you remember. This month is World Oral Health Day. We'll be doing a lot of education. We'll be making a lot of noise about it. You can take opportunity of that. There'll be free screenings going on around. You can take opportunity of that and get yourself screened. It won't hurt at all. Most of them are free. And then you get to know whatever is going on. If it's much better to know what is going on than to be in the dark and then a disease springs up on you. So let's take our education very seriously and then get screened.
Okay. So what does a typical dental visit look like? Some people say you have to get your teeth cleaned as well, and some say it's a painful process if you have sensitive teeth. So yes, what does a visit look like? A visit to the dentist.
So the visits, basically you'll be asked some questions. They'll take your history, then they'll examine your mouth, because the history is very important because we want to be sure that certain diseases you have will not bring other repercussions on your overall health and your dental health as well. Sometimes the dentist will be the first person to detect a medical concern you may be having. There will be some lesions in your mouth. You may not know that it's stress that is causing. There's some ulcer we call aphthous ulcer. And most of the time, it appears, it comes and goes, You don't know, understand. A further question would derive that it's probably the stress you are going through. Somebody will have a lot of jaw pain. They wake up with pain all over the jaw and then the neck. You find out that they are going through stress and they are clenching. We call it bruxism. They grind their teeth at night. They clench. And as your dentist that may know that you are going through some psychological problems. Maybe the first person to know, you will have to refer you to a psychologist or psychiatrist. You end up with, somebody may come with bleeding gums, but there are no calculus and ulcers. We'll have to do some blood tests. We'll find out that you have diabetes. So sometimes your mouth is a window to the rest of your body because there's some things going on in your body. It'll first show in your mouth. Vitamin C deficiency, you have bleeding gums. So taking your teeth very seriously, will help you to know what else is going on in your body. Okay. So the examination, the history will also help to identify all these things. And then the examination will come along. Then if you have to do cleaning, we'll do that. If it's sensitive, we'll know how to bring it down. There are other types of tools to use that will not give that sensitivity you're afraid
Oh,
of.
okay. So let's talk about tooth sensitivity. How would I know that my teeth are sensitive?
Oh, you
And
feel
how,
it.
okay, so and how would the doctor know that I have sensitive teeth as well?
So, with a short spray of air, there's a tool we have on our chair. We can blow air on it. And sensitive teeth, as soon as cold air touches it, it's sensitive. Cold water, it becomes sensitive. So we'll use some of these tests. Sometimes we use ice too. So there are tools that we use. And they'll also ask you questions if you've been taking lots of citrus fruits, because acid will abrade your teeth, will wear your teeth, and it will become sensitive. If you're using a hard bristle toothbrush, it will become sensitive. So there are some questions that we'll ask that will bring out some of the pointers, and then will lead us there.
Right. So let's talk about bad breath.
Okay.
People who have bad mouth odor. What are the causes, and how would one know that it's time for me to go to a dentist because might be a problem?
Okay, so bad breath. I'm sure you've heard around people advertising their products for halitosis. So that's the technical word for bad breath. Now it becomes a problem when other people around you can also perceive it, and it's worse when even in the afternoons and evenings when it should have toned down, because the times of day when it's really worse, everybody's mouth is a bit unpleasantness in the morning, the first breath in the morning, but then after brushing and then rinsing, if it's still there in the afternoons and evening, then we know that it's getting worse. Then if other people can perceive it, then we would have to look at it. Then if yourself, you look into your mouth, you can see stains, you can see plaque and calculus, then you know you need attention, because those are the number one factors of bad breath.
Okay. So what causes it, first off?
So the first thing I said is the plaque and calculus. So these are, if you look, people have accumulation of plaque and calculus. These yellow, dark things stuck in between the teeth. So plaque and calculus is the number one factor. And they are the buildup of food debris that the brush was not able to effectively clean off. So they stay there. It's sticky in the beginning, but once they stay there and they are not brushed off, it becomes hard like stone. So that's why it's called calculus. Calculus is Latin or Greek for stone. So it stays there, and it's only when you come to the office, the clinic, that we can use a machine to scrape it off. Okay. So because it contains a lot of bacteria and then food debris, it gives offensive odor, and that's what can give bad breath. Then again, there's a structure at the back of the mouth called the tonsils. Tonsils, they have these tiny, tiny holes. It's the flesh. It's the flesh at the back of the mouth, but it has these tiny, tiny holes. Sometimes some of these calculus can hide in there. But most of the time, the ENT surgeons are the ones who detect it, because they work more in that area. But the dentists also can also detect it. Then also, chronic sinusitis. The sinuses are these air spaces inside our heads, in these areas next to the nose. They help to make our voice sound nice. Otherwise, we'll all be talking like with a nasal voice. So the sinuses are there. They are just air spaces. But sometimes when you get a cold and the infection gets trapped there, fluid connects there. So over time, it gets infected. And that can also release offensive odor through the mouth. Sometimes, so some people have ketosis. That's a stage of diabetes. The glucose in their body tends to burn some certain gases that give of this offensive odor. So people with gastric problems as well may give offensive odor to their mouth. So these are some of the causes of bad breath.
Okay, so what can one do to prevent bad breath? Or what are certain things that can help? So maybe you've eaten a lot of onions and you have to go back to work, what's a quick fix for that kind of breath?
Something like that, then you really have to brush. But then if there's no toothbrush or toothpaste inside, then we recommend a sugarless gum. Sugarless gum means that it has other sweetness, not the sweetener that can cause tooth decay. Okay, so you find out that the brand of toothpaste, the brand of chewing gum says sugarless chewing gum. So chewing a gum can take away, or a minty gum can take away that oniony breath. But if it's from food, that is a quick fix. But then if it's the cause of a disease, then you would have to visit the dentist or the ENT surgeon to know the exact cause. If it's cleaning you need, if it's antibiotics you need, if it's other forms of treatment, gum disease treatment, then we'll have to take care of that.
Okay, so you mentioned that you have to brush. So do you necessarily have to brush after every meal of the day?
Oh no, that's not required. Because like I said, the mouth is also self-cleansing. The saliva, the tongue is also cleaning away some things. So you are good to go with your brushing in the morning and then the evening. That is the effective brushing I spoke about. If you do that, you are okay.
All right.
Then in the day, afternoon, you can only rinse your mouth with water. You'll be fine.
Right. Okay, so now let's talk about over-the-counter treatment. So now, recently I've been seeing an advertisement for oral probiotics, as in you can take them and then they will help with your oral, the health of your teeth and your gums and everything, and they will help with your breath as well. And I've also seen at-home whitening products, as in you can buy them, and then when you get home, you put it on your teeth, and you strip it off, and then your teeth are whiter. So what do you, as a dentist, what do you suggest? Should we consider these ones as well?
Okay, so with the probiotics, I'm yet to see them myself, but from the little explanation, I think we have enough. The normal flora in the mouth is good enough. I don't think you need extra to boost it in any way. Unless there's some peculiar situation going on, your mouth is overly clean. And there's nobody with an overly clean mouth that will need extra probiotics. But as normal as it is, I don't think it's a normal requirement anyone should be taking unless there's a specific concern your dentist will recommend. Then with the widening, we have to know exactly which source to go in for, because like I said, over widening can lead to sensitivity. So you should be guided by the professional. How often you do it, which products you are using, because some can hurt your gums, they can burn your gums, and then some can over whiten. And once you go back to eating our palm oil, our Coca-Cola and all these dark foods, they easily stain. So you'll be tempted to do it again. But then widening, most of them recommend that you do it every 6 months. Some will be tempted to go for it even within 3 months or within 2 months. So should be guided by the professional as to how to do it. The over-the-counter whitening products, they don't effectively whiten as the ones we do in the clinic. So it may not achieve the exact whiteness you wanted. So you may tend to overuse it, and then it will lead to sensitivity, which will be harmful.
Right. Thank you very much. So at this point, we would like to take questions about dental health care. If you have any questions about taking care of your teeth, feel free to ask. Any questions?
Hello?
Okay. Yes.
Praise the Lord.
Hallelujah.
So the Bible says something very interesting about a bad tooth in Proverbs 25, verse 19. Something that nobody wishes to have. But Dr. Maria, when do you recommend that you remove a bad tooth? Is it when it aches or when it makes you uncomfortable? Then you just go to the dentist and get it removed, or there's a stage that the professionals will try
Yes,
to.
that's an interesting question, and from the point you started from. So yes, so from the past, everybody will come with a bad aching tooth for it to be taken off because the pain is so unbearable. But there are current approaches to treating a dental pain, a toothache. So you don't have to take every tooth that is hurting off. So not unless the bone, we take an X-ray and we see that the bone around the tooth. So not unless the tooth, the bone around the tooth is almost gone. So if this is the tooth, if you look at the X-ray, you see that there's no bone around the tooth. It's just flesh that is holding the tooth. Then the dentist may recommend that the tooth be extracted. So once we take an X-ray and there's healthy bone around it, there's good bone support. The tooth is healthy, it can be restored. A treatment we call root canal therapy can solve the problem. Again, if we take an X-ray and the tooth is cracked all the way from top to bottom, that is to the root, we cannot work on it again. We'll have to take it out. So those are some of the instances that a tooth will have taken out. But if nothing else and it's just pain, we'll take out the nerves that is causing the pain and you'll be fine.
Any other questions?
Okay. Hallelujah. Hashem is me any now all my explanation look I say say I call roots in the pine a quine bell some will be too. Bibi sanam tia. But my coco for noche. Ama a move cha X-ray no. Maybe dear no. The doctor can yes I know you but so much. And I'm not me back to a naming as a sensitivity. Mixing and I'm in tipping but since I may know me the dinner me who say a janny because share baby me see me they made toothpick yeah. Say me sinu too and one boo by itself. And no boo boo by itself, and see me, my crumb on my child, some person more into me singing now. And yes, serious. If it's Miss Swelly Pana, I may answer. Maybe tell me.
Okay, Tikakana Vete and me is all say a boo boo, a macaca. Aha. Intina make us say the only instance a bit 2 year when the bone around it is gone. And I say more pie from top to bottom. That is a wantini. The only no our top no. That's not all. A bit shadow penum. Inti say a bubua. In my mind, I'm thinking that a be the shadow penum say be so bubu frame. How would you know?
No roots, no hormones.
But were you willing to restore the top one? We'll say the technicality of what she's saying. So the top part of the tooth that we all see was broken off, and some still remain in the roots in the bone. So we can also do what we call a crown. To say a watch and a sheso. It's an expensive procedure. Would have to do a root canal and then build the core and put the core is like an iron rod and sign a cement a flow or so and has a column number. So if all these things you're not ready to do it, then your only option is to take it out. So whatever it is, there's a solution. What matters is
money.
That's why we say go to the dentist every 6 months. Let us know what is going on. And then we can prevent some of these things. Then it wouldn't have to become expensive. Thank you.
I can repeat the
Hello?
question. She says, how about the wisdom tooth? Yeah. Yeah, that's it. Yes. Right. Should I repeat it?
So the wisdom tooth.
She said she has heard that if the wisdom teeth hurts from time to time, you'd have to take it out. Otherwise, it might decay and affect the other teeth. So, how true is that?
So little clarification. It's not taking out because it will decay and affect other teeth. All other teeth can also decay and affect the others. Like I said, it's not all teeth that have a decay that you take out. There are ones that you can treat. The wisdom teeth is mostly taking out because it's a tooth that where it is, you don't even chew with it. So even in the States and in Canada and the developed countries, once they come out age 18, 19, it's recommended that you take it out because it's just going to cause pain as it's growing out. So most of the time the dentist will take it out, but here it's not a policy that once the wisdom teeth comes, you go and take it out. It's only when you have issues with it. Now, the wisdom teeth always has issues because because the jaw has accommodated all the other teeth, that the space left for the third molar is quite small. So most of the time, it tilts itself, is not straight as the other teeth. It tilts itself. So it's the tilting that is putting pressure on all the other areas. That's the trouble it's causing, giving us the opportunity to take it out. So any tooth that decays and you leave it, yes, it's going to cause an infection. But so if it happens with the third molar, you take it out. So it's mostly taking out because you mostly don't use it to eat. So you can sacrifice it and be fine.
Yeah, thank you. Okay, so I also have a question.
Yes.
See, there is a natural remedy to most of the things, like eat this to avoid this, do this to avoid that. When it comes to oral hygiene, is there any natural food, any natural thing that we can eat? I don't know whether you said and I missed it, but is there a natural food, natural thing that we can eat that you recommend that would essentially strengthen the teeth or do something to the teeth? Thank you. Aside milk, as we were told growing up, like, is there any other thing?
Well, yes. So the mineral containing foods, so the foods that are high in calcium, you're right about that. Then your normal minerals, your rice, your starchy foods, a healthy, balanced meal. So there are no particular foods that can help to build up your teeth, because your teeth, the way it is, it's not like bone that is alive that you have to. I don't know how to put it. It's like your nail. Okay, so it's not so much alive that you need to be feeding it. The only part that has to be fed is the pulp, where the nerves are. But that one, it depends on the rest of your body. It's connected to the rest of your body. And it doesn't really, so the enamel is not really dependent on nutrition. Once it's formed, it's formed. And it forms when you are a child or you're a baby in your mother's womb. So your normal balanced diets, you are fine. Then the things that you have to avoid, you really have to avoid to maintain the integrity of it. Yeah. You're welcome.
Any other questions?
Yeah, Dr. Maria.
Yes.
Okay.
Please.
So this is my question. With regards to how we brush our teeth, could it be most of us, we've been doing it wrongly because, it's normally passed on. Your mom will hold it or your dad will hold it this way, then you do it. But I've checked on YouTube. I've seen almost about 4 different ways. So which one do we follow? And I would love you to recommend what probably professionally you say, okay, go this way or go that way.
Okay.
For, maybe we are even causing some of these problems to ourselves. I don't know. I
Okay.
stand to be corrected for that.
Then I should have brought a video
Yes.
to demonstrate this. So we normally recommend the BASS technique. So you can go online and check the BASS technique, BASS. So you open the mouth. You don't brush with your teeth together. You open. You start. If it's the top you are starting with, that's fine. If it's the bottom one, that's fine. So you start from the last tooth. You put two teeth together. You tilt the brush at 45 degrees angle. Then you go in circular motion, not the front and back, not the up and down. So the front and back, what you do is that the brush will be passing over the gum and you'll be cutting your gum. The up and down, so you'll be pushing your gum and you'll be revealing the ones hidden inside, which will lead to sensitivity. We call that gum recession. The gum is receding. So the right way is to go in circular motion. Circular motion, 2 teeth at a time, because the molars are big. So 2 teeth at a time. They come to the premolars. There are 2. You do those 2. They come to the front teeth, the flat ones. Those ones, you start from the top, you sweep it down, sweep it down, sweep it down, sweep it down. They go to the palate area, sweep it out, sweep it out, sweep it out. Then the bottom one, the bottom front area, you sweep it up. So opposite of what you do to the top. So you sweep it up, sweep it up, sweep it up. Then you go to where the tongue area is. You sweep it up, sweep it up, sweep it up. The back is always circular motion. Then you be coming forward. You be coming forward. You get to the front, sweep, sweep, sweep. You go to the back, circle, circle, circle. So you should spend about at least 2 minutes, or the length of time of a song played on the radio. Radio people, because of payola, they won't play the entire length of the music. They'll play just a small bit of it. So 2 minutes, you are good. Just to ensure that you don't spend too much time on one side. Some people absent-mindedly will be brushing one side for the rest of the day. The rest of the time, they are brushing. Just be brushing on one side. And then lest I forget, you don't scrub. So the front and back method, you tend to apply so much force that you be doing scrubbing motion. No. The scrubbing motion will hurt your teeth and your gums. That's why we recommend the circular motion, which will be a bit gentle, a bit more gentle. So you go in circular motions. From the back to the front, you do the sweeping. Then you go to the back. Then you come down, start from the back all the way to the front, sweep motions, then to the back. Then you end with the tongue. Either use your tongue scraper or the brush that has the tongue scraper at the back. Use it to brush your tongue, or the bristles of the brush itself. Use it to. As for that one, you can scrub. It will do a good job. Then you rinse it with water. Then you are done.
Right. Any other questions?
Please, can you tell me more about the structure of the teeth?
The teeth. So the teeth, the one we all see when we smile, is called the enamel. So the teeth has 3 layers. The one we all see when we smile is called the enamel. For adults, the color is from light yellow to dark yellow. It's never white. If you see somebody with very white teeth, they may have tried to do some whitening. So it's not pure white. You would have some tint of gray, dark shades of gray, or some tint of yellow. It's healthy. Then the next layer is the dentine. Now it's the dentine that gives the shade of the enamel. The dentine is very yellow to dark gray. It gives the enamel that color we all see. Then from dentine, you go to the inside of the tooth, which has the blood vessels and the nerves. And it's called the pulp. The pulp. So these are the layers of the teeth. Now, for the outside, what I said, you have enamel. When you come to the parts that the roots of the tooth that is inside the bone, that outer covering, that one is called cementum. Cementum. So for the roots that are inside the tooth is cementum, dentine, then pulp. So that's the layer. Those are the layers of the teeth.
Okay. So in choosing a brush, are there factors that one needs to consider? Because when we go out there, they tell us this is soft, this is hard. Then I think along the way we came across smokers. Then I'm like, okay, maybe that one is not for us. I really want to
You
understand.
don't smoke.
Yeah, obviously. So, on what would be the criteria for selecting a type of brush to be used by an individual based on age? What's the criteria?
Okay, so I'll start with the children since you're a parent. So for children, you go for a soft bristle brush. So the bristle is the one you can use your thumb to pass on, that it spikes, the one that will brush your teeth. So those are the bristles. It should be soft. Then for adults, medium bristled brush. We do not recommend hard bristled toothbrush at all. Then you move on to, do you prefer a flat surface one or the ones with a zigzag? The zigzag is nice because it can enter into all the different crevices and the different spaces, tiny spaces. And because the teeth is not one flat surface, it has curves and lines and all that. The zigzag ones will do a better job in cleaning than the flat top ones. Then for an extra measure, you can have a brush with a tongue scraper at the back. I mentioned that the tongue scraper, the lines, when you turn the brush over, you think that it's a design of the brush, the head of the brush. It has these lines on it. Some can be zigzag or straight line. You can use it to clean your tongue, and it's called a tongue scraper. You can also go for an electronic toothbrush. And we recommend that for people with motor problems. Maybe you have stroke or disability, you can't have enough force to brush, you can use the electronic toothbrush. Or if you are feeling fancy and you can afford it, you can also enjoy an electronic toothbrush. Yes, so those are the types out there.
Any other questions?
Dr. Maria, does
Yes.
A poor diet has effect on the teeth?
Not on the teeth per se, but on the surrounding tissues. So the tooth is surrounded by gums. Then inside the bone is attached to the bone by other tissues we called periodontal fibers and ligaments. Now those are still, it's like enamel. They are flesh. They need blood. And blood carries food nutrients wherever they go. So if the tissues around the tooth lack blood supply or it carry infections, bacteria, a disease can happen. The tooth itself is a non-living material. It doesn't depend on blood, but the structures inside it, the dentine that our lady asked about, the layers of the teeth, the dentine and the pulp, they need nutrients. So if you have a poor diet, you can end up producing very weak teeth. So with time, it cannot absorb the shock. So shock from the chewing forces. We tend to chew a lot of, Africans, we tend to chew a lot of hard fibrous foods. The yam, fried yam, tough fried meat, all these things they contain a lot of high forces. So if you over chew, you tend to feel a lot of pain in your muscles. So they have a lot of fiber. So if your teeth are not strong enough, they become brittle, and then with time they break. Poor diet can lead to other medical issues that will make your teeth prey to periodontal disease. And then you cannot fight off diseases as it should be. So poor diet, not necessarily the teeth itself, but the supporting tissues will be mostly affected. Thank you.
Okay, we have another question. Our last question.
Okay, thank you. Dr. Maria, what's your take on this? You see, as we use our brushes, over time, it shrinks, right? I also was recently chanced upon a video where they were saying that the material of your brush may have an adverse effect on you in the long term, where they were recommending that we should go for wax materials. I don't know your take on this. And then if we cannot afford, how long should you use your brush ideally?
Okay, so ideally, brushes are supposed to be used for a period of 3 months, because as you're aware, you can go home and look at your brush, open the bristles and look at the bottom of the brush. You will see a lot of toothpaste debris stuck there. Once you brush, all you do is just rinse it 2 seconds under water, and then you are done. So over 3 months, they can accumulate some bacteria. Even if it still looks good, it still looks new, please try and replace it. Before 3 months, if your brush start looking like they want to go to Jerusalem, they are opening up, the Red Sea is parting, please change it. It should be straight and firm. But then if it starts looking down, it starts bending, then it's time to change your brush. So 3 months is the cap. Then the material of the brush, I'm yet to come across it being a widespread issue. You know, there are concerns with plastic in general, with environmental concerns, release of this chemical they used to manufacture plastics, BPA. BPA, if it's consumed, can lead to cancer. So now the people who are environmental activists are recommending things that are environmentally friendly and can degrade naturally. So some waxes are of natural source. So those ones are biodegradable. That's why activists are recommending that. But to be honest, it's hard to come by. I don't know any company that is marketing that in Ghana. So within 3 months, if you change your brush, if you make sure it doesn't have BPA in it, then I think you are good to go.
All right, thank you so much. So before we round up, there are questions online. So, can you talk about bad breath and what causes it? Is it possible to have clean teeth and clean tongue and still have bad breath?
Yes, we've talked about bad breath.
Yes.
So I suggest they can rewind and then get to that part. But the clean teeth and still have bad breath. Yeah, if you are brushing really well and still have bad breath, it may be from other organic causes. That is the sinusitis I mentioned, and also other gastric problems you may be having. So you may have to get a referral. The dentist may have to refer you if they've checked you and there's no dental concern. Then other history and examination and other lab tests they may do can reveal what is going on, but it is possible to have that.
Is it advisable to brush the teeth of a
Yes.
1-year-old?
Yes, it is. It's very, very, very good to do that, because once you start brushing, we even recommend that you brush from the age of 6 months. That is when the first tooth starts to appear. Even before then, as they take breast milk, every now and then you have to be cleaning the mouth. For babies, we recommend salt water. So right from as a baby, you start cleaning the mouth with gauze and then salt water. Then as the first tooth comes in, you get a baby toothpaste. You use a baby toothbrush. Those are made of silicone brushes, or even with the gauze. Just a small dot of toothpaste, or still the salt water. Use that to clean that. Even if it's one tooth, yes, clean it. What you do is that it's building a conscious, positive attitude towards oral health. So that by the time the child is 2 years, he or she will not be fighting you to brush their teeth. So as babies who do that, babies who have parents brushing their teeth right from the time they are babies, accept brushing. They won't fight you. So it's recommended even from the time of their babies, you start cleaning their mouth till they are able to do it on their own. Thank you.
All right. So your final words for someone who is looking into, getting better with their oral hygiene. What are some tips you have for them? And then for the other person who is scared about, visiting the dentist because what are the costs involved? Dental health seems expensive and all that. What words do you have for them as we round up?
So my last words will be to brush is inexpensive. Floss is inexpensive. Morning and then evening, you do your effective toothbrushing, you floss, and then you are good to go. Twice a month, your birthday, Christmas, a holiday coming up, you visit the dentist. You hear of oral screening or education outreach program somewhere, in church, in a school, in a hospital, you take advantage and you get it done free of charge. If it's a checkup, if you have national health insurance, any public hospital with a dental facility, you walk in there, they'll do it for you. Depending on which facility you go, you may not pay even up to 100 cedis to get registered. Once you get registered and you have your card, you just go for a checkup, not any treatment. You won't pay so much. So that is how inexpensive it is. And you can walk up to me or any medic for an advice. You've read something somewhere or something is happening to you, please approach someone, a nurse, anybody for an advice or to be referred to somebody. There are lots of health professionals here in our church, by God's grace. Ask for help or advice and you'll be fine.
Right. Thank you very much, Dr. Maria. Can we give her a round of applause as we leave?
Thank you so much for coming. Thank you so much, guys. God bless you so much, Dr. Maria.